Welcome to part 2 of Women's Health New South Wales training, an introduction to sexual assault-related non-fatal strangulation and acquired brain injury. This training session is broken down into 3 short recordings. It's advised that you complete part 1 before watching this session. Before continuing, I would like to begin by acknowledging the traditional owners and custodians of the land on which I'm recording this training today. Today, I'm on Gadigal land, and I pay my respects to elders past, present, and emerging. During this session, I talk about and use images of violence against women. If at any time you need to engage in self-care practices, please do so. The overarching purpose of these recorded training sessions is to share with you some of the latest information we have on non-fatal strangulation and acquired brain injury. During part 2, we talk about what happens in the body when pressure is applied to the neck, the signs and symptoms of non-fatal strangulation, and how non-fatal strangulation impacts the brain and what an acquired brain injury is. What happens inside a woman's body when she's strangled? To understand this, first we must understand some anatomy. We have arteries, represented by the red tubes in this diagram, that feed oxygenated blood to our head and brain. We have veins, represented by the blue tubes in this diagram, that feed deoxygenated blood from our head and brain back to our heart for reoxygenation. Strangulation can partially or completely block the jugular vein, preventing blood from leaving the head. If the carotid artery isn't compressed, blood continues to feed into the head and becomes trapped. This results in an increase in pressure inside the head and brain. At this point, victim survivors say they feel a crushing pain in their head, or they feel like their head is about to pop. Other signs of raised pressure in the head include bloodshot eyes and petechiae. Petechiae are tiny bleeds under the skin that cause red spots around the eyes, the backs of the ears, and/or in the mucous lining of the mouth. Increased pressure can lead to arterial dissection. Arterial dissection is weakening of the artery walls to the point at which they're at risk of narrowing and/or collapsing in on themselves. Arterial dissection is considered a major risk factor for stroke and intracranial hemorrhage. In comparison, if strangulation blocks the carotid artery, blood supply is stopped from entering the head and deprives the brain of oxygen. The delay or stagnant flow of blood increases an individual's risk of suffering from an anoxic-hypoxic brain injury or having a stroke. Anoxic-hypoxic brain injuries are brain injuries caused by a lack of oxygen versus blunt force trauma to the head. Pressure or trauma to the airway can constrict the airway enough to stop airflow and lead to asphyxiation, a state or process of being deprived of oxygen. This can cause an anoxic-hypoxic brain injury. Trauma may also cause swelling, which increases pain and may later make it difficult to breathe. Studies show that it can take up to 36 hours for swelling to occur. The data gap makes it impossible to determine the number of strokes and brain injuries caused by non-fatal strangulation. Other injuries that can occur when pressure is applied to the neck include pressure on the carotid sinus nerve. The carotid sinus nerve isn't on this diagram. The carotid sinus nerve sits internally behind the ear and it comes down branching around the carotid artery. Pressure on the carotid nerve can cause cardiac arrhythmia, being irregular heartbeat, bradycardia, being low heart rate, and cardiac arrest, being no heartbeat at all. This is the most unlikely cause of injury or death because it requires pressure to be applied in a very specific location. Direct or indirect pressure to the back of the neck can cause injury to the spine and/or spinal cord, which may result in permanent spinal injury. This usually only occurs when the victim survivor has been lifted off the floor or shaken during the incident. Trauma to the thyroid can cause swelling of the thyroid or a fracture of the thyroid cartilage. Although injury to the thyroid is described as rare, injury can lead to severe hormonal imbalances that can impact on the woman's mental and physical health. Finally, a hyoid bone fracture may lead to airway laceration and/or swelling of C-spine tissue, specifically tissue that sits at the front of the C-spine rather than that at the back. This can provoke severe upper airway compromise. Looking at the pathophysiology, what happens in the body during injury, we can see how in circumstances where there's no pressure being applied to the airway, but pressure is applied to the arteries, veins, or nerves, a woman may still be able to talk despite being close to death. This table identifies signs and symptoms of non-fatal strangulation. Usually, these injuries heal within days to weeks after the incident. Studies tell us that roughly 50% of incidences of non-fatal strangulation result in no external signs of injury. A US study that reviewed autopsies of those whose deaths were a result of strangulation also found, despite being the cause of death, some victim survivors had no external signs of strangulation. This is a reminder that despite not having obvious physical injuries, victim survivors still may be seriously injured. This table is broken down into two columns. In green, we have signs and symptoms that are obvious and easy to identify. In orange, we have signs and symptoms that may be more difficult to detect. For example, hidden signs can be difficult to identify because the screener is unfamiliar with the woman. For example, if you don't know what her baseline behavior is, or you don't know what her normal voice sounds like, you won't know if these things have changed unless you investigate and ask questions. Another hidden sign might be limb weakness or blurred vision. Again, you won't know this unless she discloses it. She may not tell you if she's minimized the seriousness of the incident, or if her circumstances, such as sexual violence and/or domestic family violence, have impacted her decision to disclose. There may also be times the responder contributes her hidden signs to something else. For example, she's slurring her words, she's uncoordinated, so the responder might think that she's intoxicated. Memory loss can also impact recognition of strangulation, simply because not all women will recognize that they have memory loss. They can make taking a history difficult, and we need to be mindful not to ignore responses such as, I don't remember and I don't think so. When it comes to how much time a woman has before serious injury and/or death, we really only have a single American study to guide us. This study, which was completed in the 1940s before research ethics were a strong consideration. The study found a consistent timeline of symptoms occurring when pressure was applied to the neck, interrupting blood flow to the brain. This timeline includes loss of consciousness at 4 to 10 seconds, convulsions at 15 seconds, involuntary urination at 14 to 40 seconds, loss of bowel control, only in some participants, at 30 seconds. Importantly, after 20 to 30 seconds of continued pressure on the neck, participants experienced significant slowing of the heart rate that sometimes required the use of drugs to reverse. Upon return of circulation, participants reported memory loss, confusion, and mood changes. A few things to note about this study is that all participants were male, aged between 17 and 31. Not all were considered healthy, and the pressure applied to the neck was measured and controlled. Knowing that women and men have different pathologies, knowing that during incidences of strangulation, individuals don't have a way to measure pressure, makes it difficult to judge how accurate the timeline is for this study. But what it does show us is a consistent sequence of events following strangulation and can help responders identify more serious incidences. For example, if the victim survivor reports having lost bladder or bowel control, then we know that they were strangled past the point of losing consciousness and that they're at a greater risk of more serious injuries, including brain injury. Before we delve into how non-fatal strangulation can affect the brain, it's important that we understand the terms associated with brain injury. First, brain injuries are any injuries that cause structural or functional changes to the brain. We can see from the diagram that there are multiple ways in which brain injuries can occur. The ones that are relevant to us are anoxic-hypoxic, referring to a lack of oxygen supply to the brain. Brain injuries caused by a lack of oxygen are called anoxic-hypoxic brain injuries. The difference between the two terms is in the degree in which the brain is deprived of oxygen. They are often used interchangeably, and we're going to do the same. Another causation for a brain injury is strokes, remembering that a stroke can be a clot or a rupture of the blood vessels in the brain. For us, strokes are important because women who experience strangulation are at a greater risk of stroke. The last one that relates to us is trauma. Trauma such as a hit, bump, or blow to the head causes an impulsive force that shakes and damages the brain. This is called a traumatic brain injury. We have included trauma to the head here because other forms of violence are often inflicted in conjunction with strangulation. For example, in a sexual assault where there has also been punches, kicks, and/or slaps to the head. All three examples of brain injuries fall under the umbrella term acquired brain injury, which is any brain injury you weren't born with. We also have included the definition of mild, moderate, and severe brain injuries. What's also important here to note is that individuals do not have to experience a period of unconsciousness to have a brain injury. Also, mild brain injuries are diagnosed through a set of signs and symptoms because mild cell damage in the brain doesn't show up on imaging. The information on this slide is from a resource that I was given by a doctor in Orange involved in the rehabilitation unit there. This resource is given to individuals who have a concussion, also called a mild traumatic brain injury. This resource is used to inform patients how to take care of their mild brain injuries at home, because typically only those suffering from severe brain injuries will be referred to a brain injury unit and/or managed as an outpatient. It's worth noting that although this resource is comprehensive, it doesn't consider family domestic violence and sexual violence as a potential causation for brain injury. Despite this, it does have clinical value and provides a great outline for the development of context-specific resources. In this slide, we can see that common signs and symptoms of brain injuries mimic signs of stress, mental health disorders, substance abuse, and/or hormonal imbalances. We need to be aware of this and be prepared to advocate for our clients in a healthcare setting, particularly those clients we believe may be suffering from a brain injury. I also want to focus on the quote on the right. Studies have shown that these symptoms can last from days to weeks, but improve over time when managed well. The second quote, having other stressful things in your life, leading a busy life, working in a demanding job, or returning to study can make it difficult to cope with a mild brain injury. Our challenge here is trying to find ways in which women who experience a brain injury can appropriately rehab that injury and potentially prevent long-term brain damage in the context of these violent relationships or relationships where they're engaging in sexual choking. The data gap makes it difficult to surmise what the long-term implications on the female brain are after non-fatal strangulation. But what we do know is a 2021 research project found women who have been choked more than 5 times in their lifetime are more likely to report symptoms related to depression, anxiety, sadness, and loneliness compared to those who have never experienced sexual choking. A UK study found long-term cognitive deficits were associated with 3 or more lifetime mild traumatic brain injuries. An American-based study found that undergraduates who engaged in sexual choking 4 or more times in the last 30 days were able to achieve the same result in a memory and response test to those who had never practiced sexual choking. However, those who did engage in sexual choking used different neural pathways to get the same results, indicating that the brain had undergone a level of remodeling in order to function at its current capacity. In a study of the same cohort, imaging revealed that those who experienced sexual choking 4 or more times in the last 30 days had undergone morphological changes. Simply put, the structure and shape of the brain had changed. Changes have an impact on the way cells and tissues in the brain function. Some of these changes include increased cortical thickness, that is the gray matter of the brain that processes movement, speech, and learning. Changes were also seen in the cortical folds, that is the bumpy ridges of the brain that increase brain surface area. Lastly, advancements in brain injuries caused by blows to the head in athletes and military veterans tell us that those who sustain repetitive mild brain injuries are at risk of CTE. CTE is chronic traumatic encephalopathy. CTE made a big splash in the early 2000s. You may have seen the movie about it, Concussion, starring Will Smith. CTE is a degenerative condition that results in early onset dementia, movement disorders, psychiatric disorders, and motor neuron disease. As those who suffer mild brain injuries caused by deprivation of oxygen present the same as those who suffer from brain injuries caused by hits to the head, it's likely that those who suffer mild brain injuries after strangulation are at risk of developing CTE as well. In summary, what this slide tells us is that women who experience non-fatal strangulation during sex, be that consensual or through sexual assault, are at a greater risk of permanent long-term cognitive decline than those who do not experience non-fatal strangulation. We've come to the end of part 2 of training, an introduction to sexual assault-related non-fatal strangulation and acquired brain injury. There was a lot of information provided in this session. The main points to take away from today are: 1, pressure on the neck can prevent blood flow going to or from the brain. This can cause a brain injury, damage arterial walls, and can increase an individual's risk of having a stroke. 2, almost half of those who experience strangulation show no visible signs of injury. This does not mean that they do not have a serious injury. 3. Signs of non-fatal strangulation include, but are not limited to, difficulty breathing, dizziness, difficulty speaking and voice changes, neck pain, and headaches. 4. Loss of consciousness, memory loss, loss of bladder and bowel control indicate a more serious incident of strangulation. 5. Non-fatal strangulation can cause brain injury when oxygen supply to the brain is stopped. 6. Brain injury can also occur due to trauma to the head that occurs alongside strangulation. Brain injury can also occur because of a stroke that occurs because of strangulation. The next training session for this module is part 3. In part 3, we'll review a case study of non-fatal strangulation and discuss New South Wales strangulation laws and the role language plays in identifying those who have experienced non-fatal strangulation.